Good morning and welcome back to the channel. Dr. Walker from dentalwalker.com. I just want to give a quick reminder about people with thyroid disorders, and that's for any type of thyroid disorder, and the continued use of things like fluoride. Now, fluoride, remember, you get in your toothpaste, in your mouthwash, and your drinking water, and it really is disastrous for people who have, really anyone, but specifically people who have thyroid disorder. And here's why I say that. Remember, most of your thyroid function, thyroid hormone specifically, requires iodine. And iodine is a halide, as are things like bromide and fluoride. So if you're taking in, let's say, 100 molecules of fluoride and bromide daily, and you only take in a tiny bit of iodine, when the body then goes looking for a halide, specifically iodine, then what it does is it finds the one that looks like it and feels like it. And so it picks up, and by default, picks up things like fluoride and bromide and utilize it in the reactions that require iodine. And then it's just by numbers, right? When you have so much fluoride and so much bromide, I mean, think about it. The last time you actually ate some food that was high in iodine, like kelp and seaweed and seafood, right? When is the last time you had that? And how often are you actually using that? Each time you go out to a restaurant, you're getting water from the ice that they give you. You're drinking tap water. You're using mouthwash, brushing your teeth every day with fluoride toothpaste. All of those things really outcompete the body's basic need. Again, there's no need in your body for fluoride. Absolutely no need in your body for fluoride. It does protect your teeth a little bit from what they describe as dental caries, but there's other ways of doing that, right? And more importantly, it has no other function in your body, right? It outcompetes iodine, which is on almost every receptor of the body, outcompetes that, and then it crushes the system beyond that. Not just that, it crushes the pineal gland, which is a little gland in the back of your head, which helps to do with mood, mentation, and sort of foresight and sleep and focus and drive and energy, all those things, right? And it crushes that. And in most people, by the age of 12, 14, 15, thereabouts, it begins to calcify just because of the amount of fluoride you're taking into your system. Anyway, there are lots of toothpaste out there. I'd get rid of mouthwash as best as you can. I would never drink tap water again. And again, it's just fluoride's one of the few things in tap water. There's many, many, many other things that are disastrous in the body regarding fluoride. So I'd get rid of those things. And you can find toothpaste, if you would, that comes without fluoride. You can find mouthwash that comes without fluoride. And again, if you need that. And tap water, again, just get rid of it. And again, this really is a message for people that have thyroid disorders, grave disease, Hashimoto's, chronic thyroiditis, all of those things, right? You're crushing your thyroid essentially by having too much fluoride in your system. I'd get rid of it. Thanks for listening, Dr. Walker.